Hi, I'm Alice Park, Senior Health Correspondent for TIME, and I'm joined by former Health Commissioner for the City of Baltimore and now visiting professor at George Washington University School of Public Health, Dr. Leana Wen. Dr. Wen, welcome to TIME100 Talks.
Of course, glad to join you again, Alice.
So we're now in a very unique position where we're going to have a change in leadership in the country in the middle of a pandemic. So any transition can obviously hit bumps. What are you most worried about when you look at how the public health response might be affected by the shift in administrations?
So we've seen already that President Trump has essentially surrendered this response. There are so many steps that could have been taken that his administration simply did not. Now, here's what my concern is with the incoming Biden administration. I think President-elect Biden has already laid out a very good plan that's based on evidence. He has enlisted top public health experts and has made it clear that he's going to be listening to them, that public health is finally going to be driving this public health crisis. The problem is that of trust. You can have the best policy in the world, but if people are not following it, then it's not going to do much good. And if Biden were in office this entire time and we did not have many months of misleading information, then we would be in a different place. But now our country is so polarized, so divided, that I think Biden and his team will have this Herculean task, not just of delivering on the policies and implementing them, which I'm confident that they'll do, but actually in getting people to follow this guidance. And so for that, I hope that President-elect Biden will reach out to not only doctors and public health officials, which again, I'm glad that he's doing that, but I hope that he will specifically also reach out to 3 additional groups. First, to economists, to make it clear that the economy and public health are not at odds with each other, but actually they need to work hand in hand. Second, to prominent Republicans. And third, to pastors and religious leaders. A core principle in public health is that the best messenger may not always be yourself, that you have to find the most trusted messenger to the people that you're trying to reach. And to many Americans, Democrats and doctors are not the most trusted messengers. We need to find other people who can really help to turn this pandemic around.
And you pointed out that it's really then essentially a communications problem as much as it is, right, a public health and a science problem. If that's the case, what do you think should be the Biden administration's #1 priority when they hit office in January for addressing COVID-19?
We have a serious issue with credibility in this country because so much of that public trust has been eroded. And we know that public health depends on public trust. In public health, we're asking people in this pandemic, as an example, to do things that are just different and uncomfortable at the best, in the best way of describing it. I mean, for a lot of people, it just may be nearly impossible. I mean, we're asking people to potentially forego their wages. We're asking people to stay quarantined for 14 days if they're exposed and not even see their immediate family. We're asking people to go through a lot of hardships. And we know that people are not going to follow this guidance and have not been following this guidance in part because of mixed messaging and because that trust has been eroded. And so I think that it is a matter of messaging, yes, but it's also a matter of proving trustworthiness in order to be trusted. And so to that effect, not only should the incoming Biden team be enlisting trusted messengers, as I've discussed, but they also have to very quickly deliver on their promises. There's going to be a narrow window for them to act.
So let's take an example of, a real challenge that the Biden administration will face almost from day one, which is now we've had some good news recently about 2 vaccines, COVID-19 vaccines that are more than 90% effective. But these vaccines were developed and tested under the Trump administration. And I've seen surveys where people have expressed a lot of misgivings and concerns and mistrust about the vaccine and not really believing in the results and not really believing in the scientific process. How would you advise the incoming Biden team about how to address that specifically, like the vaccine question specifically?
So there are 3 groups that are distrustful of vaccines. There is a group that for a long time have been vaccine skeptics. They may be anti-science. I don't think that that's the group that one needs to reach immediately. This is going to be the hardest group. There's a second group, and that's individuals who, for good reason, are distrustful of the medical and scientific community. These are communities of color, for example, that have in the past been unethically and illegally experimented on. And the last thing that we would want to do with this group, by the way, is to say, you should be participating in vaccine trials, but they're then not getting the vaccine first, because that then furthers this perception that we're experimenting on Black and brown bodies. And so there needs to be active outreach to these communities. There also needs to be prioritization of these communities to get the vaccine first, because they are the individuals disproportionately affected by COVID-19. Then I think you have another group too, and those are individuals who are newly distrustful. These are individuals who are concerned about politics and partisanship taking precedence over science when it comes to approval of the vaccine. And I think for that, you need to let the scientists lead. It needs to be made clear that there are many safeguards, that no shortcuts are going to be followed in the vaccine process. But just to speak on this too, Alice, not only am I concerned about the public education, I'm concerned about the actual distribution, because vaccine approval is really only the first step. It is a very complex process to figure out how to store, manufacture, distribute hundreds of millions of doses of the vaccine. Both of the vaccines that have shown promise thus far, the Pfizer vaccine, Moderna vaccine, required 2 doses. That's an additional challenge. And just being able to coordinate with all the local state entities, private companies for that distribution will be a really remarkable challenge. We've already had Operation Warp Speed for the development. Now we need Operation Warp Speed for distribution.
You've been a health commissioner for the city of Baltimore. How confident are you that cities, states are ready and prepared and have what they need to pull off a vaccination program of this scale?
I'm not at all confident. And that's because I've been speaking to local and state health officials who have all expressed serious concern about this. If we're talking, for example, about the Pfizer vaccine that requires a storage that's 50 degrees Fahrenheit colder than any vaccine that we've ever had, I mean, that's a major logistics challenge in and of itself. What happens then if we have 2 vaccines? People will have a lot of questions about who has access to which vaccines. There needs to be a central coordination also of which entities have which vaccines. For example, maybe it makes sense for big cities to have the Pfizer vaccine that requires a much lower temperature storage and special freezers. Maybe rural areas should get the Moderna vaccine that has a much greater latitude when it comes to storage. I mean, these are really complex questions. We also don't want to exacerbate health disparities. You don't want to make it that the people who have means are able to get the vaccine in their doctor's offices, but those who are actually the most vulnerable, who are essential workers, frontline workers, are not able to get the vaccine because they are relying on the public health safety net. I also worry about the trade-offs that may have to take place. The last thing that we would want is for childhood immunizations, measles, mumps, rubella, et cetera, to be put off because those are the same places that would be delivering the COVID vaccine that now have to delay other vaccines instead. And I also worry about the supply chain. We need to make sure that there are vials and syringes and the individuals, the healthcare workers who are able to do this too. While we're in the midst of this COVID storm, that's also taking up the resources in our healthcare system. So I'm worried about a lot of these pieces. And again, I am confident, at least I'm very hopeful that the incoming Biden team will be able to overcome these challenges. But just to say that it's not going to be done overnight, and it is a huge logistics challenge all around.
And even once we get a vaccine that's authorized by the FDA, and once people get the shots, and we've just discussed that those are 2 very big ifs still, can people be confident that once they got the shot, they are quote unquote immune to COVID-19?
Yeah, it's a really good point, and I don't think we can say that. We just received news from Moderna that their vaccine is nearly 95% effective in these early part of their phase 3 trials. But we don't know if that's going to continue to be the case when over a bigger size population. We also don't know what happens with specific populations, for example, with older individuals, with those who are immunosuppressed, with children whom this vaccine has not yet been tested on. So first of all, we don't know how effective this vaccine is really going to be. But then even if it's 90% effective, which would be amazing, there's still a 10% chance that you could get COVID-19. And so we still do need to keep up with our precautions in some way, as in for the foreseeable future, we will still have to wear masks. We still have to abide by good hand hygiene. We still have to keep up some degree of physical distancing. It's going to take months, if ever, that we can get to the point of herd immunity when enough people in the population have been vaccinated that we can essentially consider COVID-19 to be eradicated. But we are quite a few months from that happening, if at all. Although I will say that the months that we have ahead of us, the 1 to 2 months ahead of us, are extremely deadly. And we should be doing everything we can to reduce risk during that period of time. We can still see our loved ones next winter, but not if we don't survive this winter.
Yeah, I was going to ask you about that because we are heading right now. The reality is that we now have rising number of cases in the United States. We're heading into flu season, and we've got potentially both the coronavirus and influenza circulating at the same time in many parts of the country. And we're about to hit the holiday travel season when people want to get together with their loved ones, of course. What advice do you have for families who really are trying to navigate these new risks and figure out whether it makes sense to get together, and if they do, how should they do that?
I would give a blanket statement, and I know this is not something we would want to be hearing, but my blanket statement is that people should not be gathering indoors at all, except with people who are in their immediate household that they live with. And that's because we have COVID-19 surging all across the country. Essentially, the entire United States is a COVID hotspot. We're breaking new records every day and then shattering them the next day. I mean, we could soon reach 200,000 new infections every day. Our hospitals are already overwhelmed, and we know that hospitalizations lag infections by a couple of weeks. I mean, it is just not safe with this level of virus to get together with people indoors right now. And so there are ways to see our loved ones. Of course, in addition to seeing them through Zoom or virtual meetings, we can see our loved ones outdoors with households spaced at least 6 feet apart, not sharing food or drink, and not getting together indoors in any way. If there's inclement weather, we should be canceling those get-togethers or rescheduling them. If people really want to get together indoors, there is a way to do that safely, which is everybody should quarantine for 14 days, meaning limit their risks in every way. Kids maybe not even going to daycare and school, and people definitely not going to indoor bars and restaurants and gyms and seeing other people in indoor settings. If you quarantine for 14 days and then get tested, it is safe to then see your loved ones. But that is something that's impractical for most people, and especially because many people are still working at this time. And if we're only seeing one another for a short period of time, that 14-day quarantine may be impractical. If that's the case, then we just really need to refrain from seeing one another this holiday season. A vaccine is on its way. There are better therapies on its way too. Almost certainly we will have a very different summer of 2021. But the best thing that we can do for our loved ones right now is to not see them in person, to hold off until the summer. Let's celebrate Thanksgiving in July.
And speaking of difficult decisions we're going to be making in order to get ourselves to the other side of this pandemic, do you foresee mandates for the vaccine, whether it's, cities making mandates or schools or workplaces? Do you see people being asked to get vaccinated before they come to work, go to school, et cetera?
I mean, there is precedent for this. We require healthcare workers to receive the flu vaccine to treat patients. We require children to get immunizations to attend school. And so at some point, I would anticipate, especially if there is an effective and safe vaccine, I would anticipate that there are requirements for vaccinations. I think it's too soon to do this, especially because in the beginning, we don't even have enough vaccine. The question isn't about requiring everyone. It's actually how do we literally distribute vaccines to people? How do we convince them to take it? And so I think we're a long way off from that. Also, we are not even doing the vaccine trials in children yet. I believe Pfizer actually is starting them, but only in children 12 and older. So we're a pretty long way off from those blanket requirements.
And when you look at the next year that we're facing, and you talked about potentially a very different summer in 2021, are you optimistic that by summer, let's say, we will be seeing the other side of this pandemic?
I hope so. I think if it's anything that we've learned during COVID-19, it's that we need to be humble about our predictions. A lot of people thought that we would get a respite over the summer, but we didn't. We actually saw a major surge across the South, the Southwest, the Sun Belt area, California. We did not see that quiescent period as we had hoped. And I hope that things will go as in the most optimistic of our projections, which is that we will have a very difficult few months ahead of us. But then ideally, we will have the vaccine available, distributed to people in the spring, such that by summer, we could be in a very different place. We could be seeing the other side of this pandemic. But that also depends on the actions that we all take right now. And I think if it's anything to convey, it's that the future here is not inevitable. We are projecting maybe 200,000 more deaths in the US in the next couple of months. We're projecting 2,000, maybe more deaths per day in the month coming up. But that doesn't have to be the case. We can all wear masks when we're in public places, and I cannot emphasize this enough. We can restrict being in indoor spaces. And in the absence of federal action that's so needed right now, even in the absence of local and state action, we as individuals can still do our part.
Well, I think that's a good message to end on, to remember that really the power to end this pandemic really lies with all of us. Dr. Wen, thank you so much for joining us on Time 100 Talks.
Of course, always glad to join you, Alice. Thank you.